Hi, my name is Stephen Barnett. I am the medical director for medication-assisted treatment, abbreviated as MAT for Fairfield Behavioral Health Services. I'm a family physician. I've been doing this at Fairfield Behavioral Health Services for almost 4 years. Suboxone is very effective if it's taken as prescribed. It is a medication that basically substitutes for opioids that people are using for recreational or because they're addicted. And it does not produce any type of mind-altering effects, but it basically blocks the receptors that those opioids use, and therefore patients can take that and not have craving or withdrawal. Now, Trexon, it works differently than Suboxone. There's several studies showing that if you take that, it reduces the cravings. It doesn't substitute for alcohol like Suboxone can kind of substitute for opioids. So it's not quite as effective. I tell all my patients that it can assist with that, and it does help probably over half of the patients, but for alcohol, you really have to do many other things like 12-step programs and substance abuse treatment and so forth. Suboxone, on the other hand, you do also need that to maintain long-term recovery, but now Trexon's not quite as effective, although there's a new study out showing a different way to dose it. This just come out, so we're not doing it yet, that may be more effective. The doctor-patient relationship in the MAT program, which is Medication-Assisted Treatment Program, is very important. The patient has to have trust with the provider because if it's not taken the way it's prescribed, it won't be effective. But there's also some complications if you don't take it as prescribed. So we have to build that trust. The other component of that is in this doctor-patient relationship, in this specific program, people are just coming out of addiction and all the behaviors and the stress that comes with that. And the physician has to be pretty stern. You know, we can't let people not follow the instructions. They have to participate in the other treatment components, which are just, or if not as important, more important. So we do have to have a firm relationship because in early recovery, you know, most people come in and they have not had good structure in their lives, and they have not had to meet deadlines or, you know, in this case, you know, keep scheduled follow-up appointments. So it is very important, and it is something that the patients that come here, I believe we have a very good client or patient provider relationship. When that doesn't occur, and it's usually just because someone that comes here may not be ready, we see that it typically doesn't work and it doesn't last very long. So building up that relationship is one of the keystones of keeping people in here. This is a long-term treatment.